Imagine a moment that you are relying on a groundbreaking new medical treatment, perhaps for a condition that has no other cure. Your hope rests entirely on the integrity of the research that brought this treatment to light. How confident would you feel knowing that the results presented were completely trustworthy and unbiased? Conflicts of interest are profoundly important in clinical studies because they can silently, yet significantly, undermine the integrity, objectivity, and trustworthiness of research outcomes. This erosion of trust can have serious consequences for patient safety, public health, and the advancement of medical science. The core reason these conflicts matter so much lies in their potential to introduce bias at various stages of a study. A conflict of interest arises when a researcher's personal interests, whether financial, professional, or even academic, could improperly influence their professional judgment or actions. For instance, a pharmaceutical company funding a study on its own drug might create an incentive for researchers to report favorable results, even if those results are not entirely robust. This is not necessarily about malicious intent. Rather, it acknowledges the powerful human tendency for bias when personal stakes are high. It could subtly affect everything from how a study is designed, including the choice of control groups or endpoints, to how data is collected, analyzed, and ultimately interpreted. Unacknowledged conflicts can lead to selective reporting, where positive findings are highlighted and negative or inconclusive data are downplayed or omitted entirely. This phenomenon, often referred to as publication bias, can distort the overall body of scientific evidence, leading to treatments being approved or adopted based on an incomplete or skewed picture of their true effectiveness and safety. To manage and mitigate these risks, clinical studies employ several safeguards. The most fundamental is transparent disclosure. Researchers, institutions, and sponsors are required to openly declare any potential conflicts of interest. This information is then reviewed by independent bodies, such as institutional review boards, often referred to as IRBs, which are committees specifically tasked with protecting the rights and welfare of human research subjects. These boards play a critical role in scrutinizing study protocols and ensuring that potential conflicts are either eliminated, minimized, or managed appropriately through measures like independent data monitoring committees. A deeper understanding of this involves appreciating the ethical principle of non-maleficence, meaning do no harm, which is paramount in medical research. When a conflict of interest compromises the scientific rigor of a study, it directly violates this principle by potentially exposing patients to ineffective or even harmful treatments. It also dilutes the collective knowledge base, slowing down genuine progress. The goal is to separate the pursuit of scientific truth from any influence that could compromise it. Ultimately, meticulously addressing conflicts of interest is not just an administrative formality. It is a vital safeguard that ensures the ethical foundation and scientific validity of clinical research. By upholding transparency and independent oversight, we protect the vulnerable patients who volunteer for studies, foster public confidence in medical advancements, and pave the way for truly effective and safe healthcare solutions for everyone. This commitment ensures that medical progress is built on a bedrock of objectivity and trust.